As a reporter covering drug issues on the streets of America, I learned long ago that some of the best sources you can talk to are medical personnel in emergency rooms, doctors and nurses. That's because those folks see in real time what's going on the streets of America, and they can tell you with remarkable precision when drugs changed, what the influences of this drug is as opposed to that one, if there's new chemicals in them. It's a remarkable thing, and I never turned down an invitation to speak with one of them. I was in Las Vegas recently and got in contact with an emergency room doctor named Andy Sheep, who works at the Sunrise Emergency Room in downtown Las Vegas, which handles apparently an enormous number of the fentanyl overdoses in Nevada, in the whole state, and a significant number of people under the influence of methamphetamine and all its psychotic symptoms. He very graciously and generously agreed to come on the Dreamland Podcast and tell us what he sees every day as an ER doc in downtown Las Vegas. So here is my conversation with Andy Sheep. Dr. Andy Sheep, thanks so much for taking some time to chat with me. I wanted to get a little bit of your history, what brought you to the Sunrise ER. How long have you been a doctor? How long have you been working in emergency rooms?
I graduated residency in 2015 from the University of Pennsylvania in Philadelphia. After that, I served in the Navy for 4 years as an ER doctor. I left the Navy in 2019, asked my wife where she wanted to go. She was from Las Vegas. So we ended up going here, and I wanted a challenge. So I applied at Sunrise, which is the highest volume, highest acuity emergency room in Nevada. And I've been working there for almost 6 years now.
Do you enjoy it?
I love it. Yes. You see new stuff every day. And just the people I work with, the nurses, the techs, they're amazing. And we just have really good teamwork. And we accomplish really good things at Sunrise.
I was wondering if you could tell me just a little bit about what you've seen with a couple of drugs that I've been very interested in writing about. And I think these are the predominant drugs in America, really on the streets of America today, the ones doing most of the damage anyway. First one I really wanted to ask you about is methamphetamine. Can you give me an idea of the problem, methamphetamine in Las Vegas, how intense the problem is, and what you see normally with regard to methamphetamine patients?
So methamphetamine is probably the largest illegal drug problem we have in Las Vegas and indeed in Nevada. Methamphetamine is very easily available on most street corners. You can find someone hawking it. It's very cheap to produce and it's very cheap to buy. It's also extremely addictive. Stimulants are very addictive to human beings, and methamphetamine lasts a long time. The initial high, when you ask people like why do you continue to use meth when it's ruining your life, the high apparently is just incredible. Over the past 6 years I've worked at Sunrise, meth has always been a problem, but it seems like it's becoming a bigger and bigger problem.
What do you see as symptoms of methamphetamine use in your ER?
So the acute intoxication of methamphetamine, you're going to see elevated heart rate, elevated blood pressure. Sometimes they're hyperthermic, their temperature is really high. And but their symptoms in particular, they're extremely paranoid. They have auditory and visual hallucinations. Sometimes, depending on how much they use, they can have chest pain, they can have shortness of breath as well. And then when it comes, so those are the acute symptoms. And then when it comes to more chronic use, you see very disorganized thinking. You see, young people that have used it for a long time. They're comparable to like very old people with dementia. They say things that don't make sense. They see things crawling on the walls. They have something called delusional parasitosis, where they feel like they constantly have bugs and they're constantly itching themselves. They have lesions all over their skin from just constantly itching themselves. They have horrible dentition. The saliva in their mouth stops flowing when they're on meth, and they just get horrible dental disease. I mean,
I'm wondering if you have any knowledge of how many of these folks are actually on the street homeless, and how many of them are somehow able to hang on to housing in one form or another. Would you know?
Sam, right before this interview, I was going on ChatGPT to look up some numbers, but I'll be honest, there really aren't good numbers on this. What I can say from personal experience from me and my colleagues that work at Sunrise is a large proportion of these people are homeless because methamphetamine is probably the cheapest drug available on the streets. But some of the crazy thing is we see people that are like normal people that have normal lives. They live in houses, and sometimes we even see older people. Like, it's crazy to me that like someone in their 60s or 70s is using meth, but they try it once and they just want to keep trying it.
I wonder if you think then it sounds to me like you're describing a supply issue. It's just so prevalent, so accessible, cheap, cheaper than ever, really. I think the prices nationwide show that meth has never been cheaper in region after region than it is today. And I'm wondering if what you're describing is simply just a supply issue. Access creates demand.
Yeah, Sam, you can get you can get a really good high off meth for less than $5. I ask my patients all the time, how much did you pay for the hit today? And it was a couple dollars. And I think that's why it's so prevalent amongst the homeless people.
I'm wondering how you've seen the symptoms worsen since you started at the ER in 2019 in downtown Las Vegas.
We are seeing way more psychological and long-term neurologic damage. I'm talking young people with dementia, with delirium, with just horrible paranoia and hallucinations. And the problem is these symptoms, depending on what chemicals they're used with, these symptoms are often irreversible. So, we have quite a few people in Las Vegas whose brains will never be the same. They're just constantly like this the rest of their life. And, whether it's nice or not, we call them meth zombies because, in essence, that's what they are.
Methamphetamine has become also, in a weird way, a gateway to fentanyl, simply because fentanyl has been shown to be, and I think street dealers and traffickers understand this very well, an easy drug to add to a variety of drugs. And I'm wondering if you now are, if you could talk a little bit about what you're seeing with regard to fentanyl in the years since you've been at the ER.
Great question. Yeah, I mean, fentanyl is another street drug that has become cheaper and cheaper over the 6 years that I've worked here. Not only are we seeing an increase of just opiate users who are asking for fentanyl, but we also see people who buy what they think is cocaine, they'll snort a line or two, and it's adulterated with fentanyl, and then they'll just stop breathing and drop dead. And, some of it is pure fentanyl. Some are derivatives such as carfentanil and remifentanil that are like 100 times more powerful than fentanyl. Some of these drugs are not responsive to Narcan. But what I can say is in the past 6 years since I've worked here, the amount of patients we see coming in with fentanyl overdoses is absolutely absurd. If you talk to any paramedic that works in Las Vegas, they always just stock their ambulance with Narcan. I think this morning I saw a total of 30 patients. 4 of our patients this morning were fentanyl overdoses.
Fentanyl has really changed the game. We never used to see with heroin this many overdoses. You never used to find people with 20 overdoses. It was a ridiculous idea. Now you see this fairly commonly, I think, across the country. And I'm wondering what you think the effect on people's brains, the brain impairment it might be from all that.
You're totally correct. You're totally correct. Fentanyl is almost in a different class than heroin. I trained in Philadelphia in the early 2010s, and there was a lot of heroin, but it did not have nearly the effect that we're seeing now with fentanyl. I mean, there are some times when we give patients huge doses of Narcan and we can't bring them back. We have to breathe for them, intubate them, but oftentimes they have anoxic brain injury. Like you said, they don't get enough oxygen to the brain. Um, the paramedics I work with in Las Vegas are amazing, and they get to the patients very quickly, identify it, and give the patient Narcan. But some of these stronger variants of fentanyl, pardon me, are very non-responsive to Narcan. So when we save these patients, we're creating an incredible burden on the healthcare system and on society because they've become vegetables basically due to anoxic brain injury. But they're still alive. So absolutely, Sam, this is just an enormous problem.
It's interesting. I interviewed a woman, put part of her interview up on an Instagram account of mine, and she told me in Tucson, and she told me that she had 26 overdoses in 15 months, which also means that she was not getting any brain healing time, and it was just right back at it with as soon as she got Narcan awake. And one of the things she told me was that she could no longer keep up with conversations. You know what I mean? It didn't flow. Everyone thought she was more thoughtful now, and she said, "No, I'm not more thoughtful. I just can't think of what to say in time for it to make sense in the conversation." And it seems to me that this is an immense change, and again gets to the idea of that the supplies of fentanyl so prevalent that they're putting it in all kinds of stuff, and then the people who survive that are kind of chained to a life of repeated overdose and eventually a brain impairment, and then finally, of course, I think they don't avoid death, but they just last longer.
Yeah, I mean, if you talk to anyone that has used an opiate like heroin or like fentanyl, they will describe the first time they used it as the most absolute euphoric moment of their life. And ever
Sure.
since, they're chasing the dragon and they need higher and higher doses. Well, some of these times when they're high, they're getting little micro strokes in their brain, and those brain areas aren't working as well. And the other problem is when you are addicted to something, that means you are narrowing the things that cause you pleasure, where you get to the point where the only thing that causes you pleasure is fentanyl. And when they're not on fentanyl, they have what's called anhedonia, meaning nothing brings them pleasure. So there are neurologic effects and there are psychiatric effects. Absolutely, Sam.
The anhedonia that you referred to, I think, is one of the more interesting ideas, sad and ominous. I'm a layman, I'm a reporter. I learned this in my studies of this kind of stuff, and it really means that you just can't find pleasure in simple things like holding hands with a loved one, for example, or being around a puppy, or it just, all of that, you become almost like a flat effect, blank slate until the drug is you use the drug again, and then that was almost like science fiction, like 1984 or some kind of weird science fiction story that people were telling when I read about anhedonia, and yet when you can see it on the street, I think fairly commonly, and I suspect you see it in your ER with some regularity.
All the time. I ask patients, I'm like, hey, you've overdosed several times. You realize if you keep doing this and you keep ramping up the dosage you use, you realize you could kill yourself, right? And they're like, what they almost always tell me is, being dead is better than being sober.
I'm wondering, how long do you think you might continue to work in an ER?
Sam, when I first started, my goal was to make as much money as I could and retire at a very early age. But weirdly, the longer I do this, the more I enjoy it. And part of that is I get to teach residents, I get to teach paramedic students, I get to teach nurses, and I love teaching. I don't know that I'll ever retire. I find when people retire, they kind of dwindle, and their social circle dwindles, and their mentation dwindles. And I genuinely enjoy my job. I love helping people as much as I can, and I love teaching younger people to be, excellent physicians. So I may never retire.
Fascinating. So amid all the ominous stuff that you see daily, you still find some a fulfillment, a great fulfillment in all this. It's wonderful. Anyway, Andy Sheep, thanks so much for taking some time to talk with me. I really, really appreciate it. Never had a boring conversation with an emergency room doctor. That is still true.
Sam, I just want to say I want to thank you for all you're doing and bringing this to public opinion, because there are a lot of people that have absolutely no clue what's going on. There are a lot of politicians that have absolutely zero clue what's going on. So I want to say thank you as well.
You're welcome. Have a great day.
Thanks. You too.